I call the meeting of the Compliance Committee of the Board of Commissioners of North Broward Hospital District to order. Jennifer, would you read the roll, please?
Commissioner Robeson?
Here.
Commissioner Rodriguez?
Here.
Commissioner Wellens?
Here.
Commissioner Klein?
Here.
And Commissioner Uri is absent for the record.
So we need to have a determination that we have a quorum. Okay. The first item on our agenda was the approval of the October 25th minutes. And I'm going to turn this over to Nick to discuss our conversations earlier.
Yeah, so based on our conversation earlier, there was a miscommunication on the formatting of the minutes, so we'll be working on redoing them and then sending them back out for review and then bringing it to the next compliance committee.
In that regard, I mean, since this is basically a transcription, and I know that maybe my accent's not picked up correctly often, and maybe some of our other commissioners have the same issue, if there's anything specifically that you have an issue with, if you'd let Nick know. I've given him a few comments, but I think the main thing is to nail it down so that it is in the form of traditional minutes and highlights the decisions that were made and the actions that were taken. So we will essentially table that item until our next meeting. And the next item on our agenda list is the update on our reportable event, and I will again turn that over.
Yeah, so I believe, Mr. Selden, are you on the phone?
Yes, I am.
Okay, so I would like to introduce Mr. Jack Selden, who's with the firm Bradley Arendt, to provide an update to the board as he has done on the past. Anytime there has been a letter sent from Mr. Richard Wessling with the Epstein, Becker & Green law firm to Laura Ellis, who's our HHS OIG monitor, providing an update on the reportable event related to the December 7th, 2016 reportable event. So, Mr. Selden.
Thank you and good afternoon, commissioners. Can everyone hear me okay?
Yes, sir.
Yes.
Thank you very much. Outside counsel Rich Wessling on November 17, 2017, 10 days ago, provided OIG monitor Laura Ellis with a written supplement to the December 7, 2016 reportable event notification. And I've been asked to update the compliance committee concerning this particular Wessling supplemental report. First, I thought I'd provide a very brief summary regarding the prior submissions to the OIG concerning the reportable event to provide some context to this latest November 17 submission. Outside counsel and former assistant U.S. attorney Rich Wessling of the Waller Ransom law firm, and who is now a partner with the Epstein, Becker & Green law firm, was engaged by North Broward in August 2016 to investigate allegations of anti-kickback statute violations by Pauline Grant during the years 2008 to 2014. Wessling and his team concluded that Broward Health North CEO Pauline Grant engaged in conduct that constituted probable violations of the anti-kickback statute. In a letter dated December 7, 2016, Wessling submitted a written report to the OIG notifying the OIG of a reportable event as defined in that particular section of the CIA, section 3K1.B. The Wessling investigation determined that the manner in which the contracts were awarded to orthopedic surgeons seeking to practice in Broward Health North's PPUC trauma call rotation, as well as the process of distributing call coverage to physicians once on the call rotation panel, violated the anti-kickback statute. The Wessling investigation determined that Broward Health North favored physicians who were able to bring additional referrals to North. Then in a letter to the OIG dated March 22, 2017, Wessling submitted a supplement to the reportable event notification. And it states that a search for additional documents at the request of OIG monitor Laura Ellis disclosed an additional physician who was excluded from the PPUC trauma call rotation, and whom Rich Wessling refers to as Dr. B, for purposes of confidentiality. Westling provided details relating to the Dr. B exclusion from the call rotation, including that Dr. B was also improperly excluded from the trauma call panel. The findings as to Dr. B expanded the relevant period of anti-kickback statute violations to include claims for the 16-month period from January 2015 through April 30 of 2016. And then in a letter to the OIG dated May 22nd, 2017, Westling submitted a response to information request and revised financial analysis calculation. This particular letter provided a revised financial analysis of the potential federal health care program impact associated with the reportable event. Then 10 days ago, as to which I'm updating the board and the committee today, on November 17, 2017, Rich Westling submitted a letter to OIG Monitor Laura Ellis as an additional supplement to the December 7, 2016 reportable event notification. This November 17 letter notes that Westling has continued to search for relevant documents at the request of both the Office of Inspector General and the Department of Justice. This supplement sets forth additional information discovered based upon the Westling effort to respond to the OIG and the Department of Justice requests relating to the reportable event. Westling references a letter from Dr. A dated February 19, 2012. That particular letter is addressed in detail in Westling's December 7, 2006 reportable event report. Westling also references his interview of Pauline Grant on October 18, 2016. And he states that during her interview, he specifically discussed the Dr. A letter of February 2012 with Grant. Westling states that Grant denied making any of the statements Dr. A attributes to her as contained in his letter. During the interview, Grant also described for Westling her role in the selection and scheduling of physicians for PPUC trauma call as quote-unquote limited. Westling states that he conducted a document review at the request of the Department of Justice in connection with its investigation into the Grant conduct detailed in the reportable event notification and the various written supplements. Westling references two additional documents discovered which relate directly to the allegations by Dr. A contained in his February 19, 2012 letter. The first is an email sent by a Dr. D to Grant on April 26, 2012. Dr. D was one of the orthopedic surgeons newly added to the trauma call rotation sometime preceding the Dr. A letter of February 2012. Dr. D had recently joined the practice of a Dr. C, who was an established orthopedic surgeon and referral source to Broward Health North. Dr. C and D met with Pauline Grant. I apologize for that ringing. Okay, let me continue. Dr. C and D met with Pauline Grant on the day preceding Dr. D's email. And I'll quote a portion of the email which states, "I'm writing to thank you for meeting with Dr. C and me yesterday, and also to reiterate our goals for the future of our practice at North Broward. Our primary focus is to increase the trauma referrals to NBMC, as this can be a major source of income for both the hospital and our orthopedic practice." The second document referenced by Westling is a set of transcribed notes from an internal meeting at Broward Health North dated September 5 of 2012. The transcribed notes include as a task, quote, Dr. C group, Pauline to speak with regarding additional elective cases. Westling states that these two documents establish that Grant was having communications with physicians about orthopedic surgery referrals during the same period of time that Dr. A's letter recounts telling Grant that promised referrals were the reason the other physicians were being added to the PPUC ortho-trauma call panel. Westland states that this is contrary to the Grant denials during her interview of October 2016. Westland also points out that the physicians involved in these communications are the same physicians who are referenced in Dr. A's letter. Westland concludes that Grant was speaking with orthopedic surgeons who were taking PPUC ortho-trauma call about referrals, and that the Grant communications with those physicians were taking place during the same time period in which Dr. A wrote his letter attributing statements to Grant acknowledging those conversations. Westland states that these documents substantially corroborate Dr. A's account of his conversations with Grant, such as when she stated that additional referrals would result in his addition to the call panel. Westland does go on to mention some other documents. He states that these other documents suggest that Grant was far more involved in the selection and scheduling of physicians for PPUC trauma call than she led the Westland team to believe during her October 18, 2016 interview. He provides, as examples, 2 post-it notes on a draft March 2012 call schedule, which reflect Grant saying no to adding Dr. B to the rotation and directing that a day of call for another doctor be shifted to Dr. D. Westling describes these documents as being significant for 2 primary reasons. They reflect that Grant was personally involved in approving the PPUC ortho-trauma call participation, and in many cases in reviewing and approving how many days would be assigned to each physician. Westling then describes this level of detailed participation by the CEO of a large hospital in the day-to-day decisions about who should be allowed to take paid call and how many days should be allotted as being unusual, if not unprecedented, and suggestive of CEO concerns about who received call assignments. The latter part, the last portion of his letter, he entitles Additional Relevant Information, and in the final page addresses and references issues relating to John Knox Village, a skilled nursing facility and referral source for Broward Health. Westling discloses that he and his team are currently further investigating the John Knox Village issues, but that some of their findings to date bear upon the credibility of prior denials by Pauline Grant relating to the reportable event. Westling notes some specific findings, stating that during the October 18, 2006 interview of Grant, she acknowledged that she made no disclosure on her annual conflict of interest certification of her John Knox Village board membership because she never saw it as a conflict of interest, and that she denied knowing whether there is any sort of contractual arrangement between Broward Health and John Knox Village. According to Westling, Grant personally approved payments by Broward Health North from June 2011 through October 2015 that benefited John Knox Village, including payments totaling over $31,000 in medical director fees to a neurologist at Broward Health North for hours spent serving on the John Knox Village board. Westling states that when a Broward Health North employee questioned those payments, Grant instructed him to approve the payments for hours related to John Knox Village board service. Such payments approved by Grant, according to Westling, were not disclosed during her interview of October 18 of 2016. Westling concluded that Grant's denials of any conflict of interest based upon her situation with John Knox Village were not credible in his judgment. Again, that investigation by Westling is continuing. That concludes my update to the committee concerning the reportable event based upon this November 17 written supplement by Rich Westling to the OIG. The district will continue to cooperate with both the OIG and the Department of Justice in relation to their ongoing investigations into the reportable event and any requests that they may have. I thank the committee for your time.
Mr. Selden, this is under Robeson. The materials that went to Ms. Ellis and the materials that went to DOJ and OIG, have we had any response or follow-up from the data that was supplied to them? I realize it was just 10 days ago on the one issue, but have we had any feedback from them at all?
To my knowledge, no feedback in terms of any analysis they've done. We've received acknowledgments and thank yous for being responsive and cooperative and promptly providing the requested information. My understanding is they may be seeking additional information.
But to date, they haven't asked for anything further.
I'm not sure we have yet completed the production they've originally asked for. I'm not sure if there has been anything additional since the last request that has come in.
Ms. Barrett, can you or Nick, can you update us on any other requests that they've asked for?
We are still in the final stages of producing the documentation from the first request from the Department of Justice.
Okay. And there's any time issue, any plan for when we would? I know you keep discovering things, but
Right.
I mean, at some point, there's no place else to look.
Right. So
so-
we've produced probably more than half of the items requested, and we expect in the next week or two to complete the production, if not sooner.
So we expect by year end, we will have done everything that we could do to be responsive to their numerous requests.
Well before, and unless we get more requests from them.
Okay. Thank you. Anyone have follow-up questions? So I guess we can let Mr. Selden leave. Thank you, sir.
You're quite welcome. Thank you very much.
Okay, I guess as an issue that's grown out of these complaints and the handling of the on-call issues is a policy that I know that Mr. Hatfield and Ms. Barrett have been working on along with Ms. Capasso and others to try to figure out a policy that we could put in place to try to make sure that there are checks and balances to make sure that this doesn't happen again, and so that those individuals responsible for setting up or arranging for call coverage as needed know the procedures that they need to go through. And I know, Nick, that you've met with a lot of physicians on this, but can you just walk us through how this draft came to be and whose input was taken into account when it was put together? And
Sure.
then just sort of summarize to us, because it's a pretty lengthy policy, how it works.
Yeah, so this, as you know, this started a while ago in drafting this in response to the reportable event. We took into, as we started drafting this, we held meetings with our RMOs at each facility. We held multiple meetings with our CEOs, Ms. Capasso, Mr. Fusco, and when he was formerly here. This has included our new COO, Gino Santorio, and also Ms. Barrett in the General Counsel's office. Sorry, there was this big meeting, so I'm trying to think of everyone that was in that meeting. Dr. Westfall is our Chief Medical Officer. All provided input into this policy. It went through several drafts based on that input. And now that we've finally got through all of that input, we feel that we have a more, well, a comprehensive system-wide policy that addresses how call coverage will be determined throughout the system, right? It'll be consistent at every hospital. And what will happen is now it'll be comprised of a call coverage management team. They're kind of, that's the team that really decides it all. And really that's kind of to ensure that not one person is responsible for it, right? So you're kind of spreading it out amongst multiple people to do a determination. Also, as part of this, so the call coverage management team is the chief medical officer for Broward Health, the regional CEOs of the hospital, and the regional medical officer as part of the call coverage management team. Also, this includes, and then the medical staff office is a big component of this as well. And within this, we've created certain guidelines for how we're going to post the opportunities so that all of our community physicians that are on staff at Broward Health are aware that these are opportunities for them. So it'll be posted within the medical staff office, it'll be posted online, it'll be posted in the physician dining room, in locations that are frequented by physicians that see patients in our facilities that are on our medical staff. So that way they know that these are opportunities, so that way we can't, that way there are no longer people seeking out physicians. Hopefully physicians will be coming to us. And then also our, as part of this, our Chief Operating Officer, Dino Santorio, is working with our regional medical officers, who's working with the chiefs of staff, to then, and then also the different department chairs to ensure that we have consistent standards for call across the system for different specialties, right? Because there's going to be different criteria for trauma versus non-trauma, and he's working on that to ensure that everything is consistent across the system. So if we have a trauma call panel for a certain specialty at one hospital and we have it at another hospital, it's the same criteria to get on. It really shouldn't vary as to, unless there is something truly unique at that facility, which would be looked at on an individual basis. And this policy, there is opportunities for exceptions to this policy at the end in regards to if there are unique situations, which some of our hospitals do have unique situations, right? So Broward Health Medical Center is a teaching facility and they have residents, and there are unique situations at that facility. So any of those types of situations, people do have the opportunity to present those. We'll take a look at them and see how we can fit them within the policy.
Has this been discussed with Laura Ellis at all? I mean, to me, this is something that's very important to show what steps we've taken to make sure that we don't have inadvertent screw-ups in the future.
She knows we're working on it, but I haven't discussed the final version with her.
Is it your plan to have this presented to the board for approval in 2 days?
I was bringing it to the committee here for you guys to take a look at.
So that if we think it's appropriate, then it would be on the consent agenda for the board meeting in 2 days?
Yeah.
Is that the way you want to do it, Mr. Mayor? Okay. Any questions by anyone about this particular policy?
Can you, Nick, can you
Yes.
also refresh my memory?
Sure.
Improve the computerized system that, or did you do something with this to make sure that?
Well, I know that Sandra Todd Atkinson and Dr. Westfall have been working on a computer program to track when people come in. Yes, because, so then that way it would be in the in our system, so we'll know if someone calls whether they responded by phone, did they respond in person. So Sandra and Dr. Westfall has worked on that. Sure.
We don't know this man.
Just
It's entirely different.
I don't know if the mic's on. Just as a quick update to that, we brought we worked with IT to create that, and we discussed it in joint conference. We brought it to all the medical executive committees at all the hospital facilities and discussed it with all the chiefs, vice chiefs, and CMOs. Everyone was on board with it, just so you know that we have the buy-in, and that will go live, I believe, the first week of December. I can follow up with an exact date on that.
That's what I remember from the joint conference, so thanks.
And then also, to another point, so this policy we did, myself and Ms. Capasso, we were invited to the medical executive committee at Broward Health North by the chief of staff there. So we went and spoke with the Broward Health North physicians regarding any questions, concerns that they had about this policy, and then also just about compliance in general, questions just about the hospital system in general, not necessarily compliance-related questions. So, I mean, and I won't speak for Ms. Capasso, but I thought the meeting went very well and was a very productive meeting.
So not only did we made it a point with my team, we hit every MEC at all of our hospitals. So we reviewed everything with the chiefs of staff, again, like Gino said, vice chief, all of the board members, and for the most part, it was very well received. We explained the need for it, they understood it. The drop box fee was a little bit different for them because now when they come in, he or she's going to have to say, yes, I'm here. But it really was well received, and just as a point of fact, we're going to be doing that. The team and I will try to get to the med execs as often as we can so that they feel we're transparent, we're cooperative with them, and it was very well received.
And that's something also I'd like to do is, as the interim chief compliance officers, attend those meetings. I think right now they're all scheduled on the same day.
Well, two are, it's
Oh,
two
okay,
and two.
okay. So try to,
Try to rotate.
yeah, but the chief of staff at North had invited me to attend that meeting to answer questions, so that's why I attended the North one.
You did a very nice job.
Just a nit question, Nick.
Yep,
Why is your title here Director of Focus Arrangements instead of your...
that's how it is in the system. So it's just, so I'm still, since I'm only interim chief compliance officer, so in the system, I'm still listed as Director of Focus
But
Arrangements, like in
isn't
the
Director of
HR
Focus
system.
Arrangements a legal department title?
It's compliance,
Okay.
yeah. So we moved those over to the Focus Arrangement Department over to the Compliance Department.
Well, I guess we need to decide whether or not we think that this call coverage proposed policy is in the form to present to the whole board on Wednesday. So I'll entertain a motion to move it forward, if there is a motion. Or if you think we need more time to go over it and bring it up in the board meeting, that's fine too.
I haven't had, because I got a big thing. Yeah. So
Well,
I kind of like to, to just, I'm sure that it's okay, it's just, I'd like to just go through it. Make
well,
sure.
I think it's important that if we're going to approve the policy, we approve it before the final report goes into Marcellus, because I would like for it to show concrete evidence of the fact that we've taken, even though it's taken a while to get the buy-in from the various stakeholders in the system, that we do know how important it is to have a procedure that works for all of the facilities, and that we've taken it very seriously. I have no problem whatsoever with it being put and discussed, if it can be discussed in the board meeting as a walk-on item from this committee.
I believe that you could make a motion to put it on the discussion agenda.
Is that the, will of the committee that we take
Well,
it?
let me ask you a question, because I'm looking through it right now. It looks like a very comprehensive document. So the question to me is, if we approve it today, okay, it'll go in as a consent agenda, okay? If we find later on that there's a glitch somewhere, we should be able to come back and, because it looks like a real good document. You know what I'm saying? And so, and a lot of people are working for this, so just because my comments are in crossed every T and dot every I, I don't want to hold this document. And if we find down the road that maybe there's something that really needs to be revised, we can always come back to it.
Well, and one thing that is interesting here is the exception policy. So it seems to me that even the policy itself has a procedure for if something comes to light that doesn't fit into one of these criteria. So I think the committee has thought that through. But it is an important policy and one of the first that we have done in this way. So I'm happy to do it either way, to have everyone have today, tomorrow, and Wednesday to look at it again and bring it up again for approval. It's got to be approved by the full board anyway.
Yeah.
And Commissioner, since Commissioner Uri isn't here, it might be better suited for discussion agenda to give him an opportunity versus consent.
Okay. That, I agree with that.
Yeah, I've read this policy a couple of times, and obviously this is nowhere near my expertise in life, as limited as they may be, but it looks pretty comprehensive. You've got a lot of buy-in from a lot of people who are intricately involved in all of these aspects. So from my perspective, you know, I'm comfortable with the General Counsel's recommendation is moving it for and letting Commissioner Uri have his comments on the board meeting. But as long as whatever we do is consistent, that we are going to revise it if it comes back from the OIG that they want an adjustment, we'll make the adjustments. But it'd be difficult to pick a sentence in here and say it doesn't look appropriate to me, because it's really not my expertise. But it looks really comprehensive and pretty well done. It looks like you had a lot of buy-in from a lot of the important elements that would make up the call schedule. So I mean, I'm comfortable with that to move it.
Yeah. And I would make the comment that any of our policies and procedures are always living documents. Right? So if we find where things need to change in any policy or procedure, we're always looking at that, we're always reviewing them, and we update them as appropriate based on, especially something that's a brand new policy. So as things get implemented, if there's any kinks, anything like that, then we'll work with the, just like in implementing our new compliance 360, our contracting system, right? So then we had to go back and revise all of, the policies related to that and get them up to date with that. And as we work through our contracting system, as things change, we'll revise the policies.
And who's the primary person who has ultimate responsibility for reviewing our this particular policy?
I do.
Okay,
Compliance
so review.
department does.
Right. So
Yes.
you'll be getting input from as need be. Okay.
Madam Chair. When he's done.
Yeah, I'm done.
Let me ask General Counsel, it's on the agenda for this meeting, because,
Correct.
I'm trying to stay away from walks on and stuff like that. It's on the agenda for this meeting that we have to do a review on this, okay? Right? So whoever is I assume Commissioner Robles is going to give a report on this, correct? At that time, what would be a problem if we send this to the board with a positive recommendation for approval?
Right. But since the board is Wednesday, it would be better if you just had a revised agenda and you put this for discussion on the agenda, since it's still 2.5 days away.
Rather than put it on the part of the committee?
You could do either.
Because
I mean, the better course of action when you have a committee is that if it's for discussion, the better course is to put it on the discussion agenda rather than to pull something out of the committee and then have a motion to place it on the discussion agenda. So now you're just saving that step.
I know. And now we have the documents out in public, so if anybody
Correct.
wants to see it.
Correct. So you can add it to the agenda now.
Okay.
So
Under
do we need
discussion.
do we need a motion to add it to the
Recommend.
discussion agenda for the upcoming board meeting?
And to recommend that it be placed on the discussion agenda, potentially for approval or discussion.
Right. All right, so I'll make a motion to add the on-call coverage arrangement document to the discussion agenda for the board meeting on Wednesday, the 29th, and recommend it for the discussion agenda. And for approval, should the board at that time feel appropriate to move it into policy.
I'll second the
Do we have a second?
Yeah.
So we have a motion made to place this on the discussion agenda and a second. All in favor?
Aye.
Opposed?
Aye.
So it will be on.
Oh, by the way, you didn't do a roll call, so I guess we're all supporting it, right?
Yeah, I think it's unanimous.
Okay.
Okay, now, the second reporting period annual report, which we have received discussed copies of, what, Wednesday night? Tuesday
Yes.
night? They'll run
Yeah,
together.
Wednesday
night.
afternoon. Yeah.
I had it on my porch when I got here, so Wednesday night. I think the best way to handle this, I mean, I've gone through and have given Nick some pretty minor comments. I think rather than taking the full meeting to flip through it page by page, that because it is extremely important, we are going to have to do a certification, and I assume the form of the resolution will be given tomorrow.
Yep.
So, and for those of you who weren't here last time, we did have a form of resolution with some significant changes to it. And I assume we're going to have some qualifications in this one as well.
But more than likely, very few. So that's what we're still working through,
Okay.
is to tie that down. But last year it was, I mean, the
Well,
board couldn't even certify,
we couldn't.
right, to compliance with anything. So I think this year, with all the work that's been done through the second reporting period, and even all the work, the massive amount of work that continues today, that we will be able, that the board will be able to certify that we are in compliance with a couple of exceptions versus last year of saying we weren't in compliance, period.
Well, we had to
here's
say
what
we
we're
were,
doing.
but we weren't. I
Right.
mean, the way the form of that resolution worked, because I
Right.
did spend a good bit of time talking to Ms. Ellis about.
Right. And I should clarify that we weren't in compliance with the corporate integrity agreement because there are two parts of the resolution, so I don't want to.
So essentially what, I mean, we've done our darndest to report everything to be in compliance with the CIA, is whether or not we have a valid and comprehensive compliance program, which
Right.
I feel 100% more comfortable than I did last time. But there's still going to be some exceptions, and they're really not exceptions, they're highlights. Like the call coverage policy, to me, is something that really shows that we have put
Sure.
something new in place and highlighted it like we highlighted the actions that we took before.
Right.
So I think, I'll wait to see what comes out, but I think keeping that in mind is that, yeah, it's something we've got to do, but at the same time, I'd like to use the opportunity, if we can put it in there, to put it in there. If we can't, to put it in a cover letter to her, because I really want,
Okay.
this time I think it's time for her to step up and basically acknowledge what this institution has done. And the part that everybody in this room has played to.
Well, I will say in my conversations with her, she has acknowledged greatly what this institution has done.
Well, she acknowledged it to me too, but it didn't come out in writing, and
Right.
it didn't make it to the public.
Right.
And so I honestly feel like we've done a lot to make steps in the right direction to try to make sure that this institution can be all that it can be and get this regulatory sort of nightmare behind us as soon as possible. And so, I mean, with that said, a lot of my issues here were just minor and stylistic, and I think that those are, and some of you will probably have those as well. Nick has graciously agreed to meet with any of you individually, one-on-one, if you have questions, if you haven't already talked
Sure.
with him to go through it. But I don't think it makes sense to flip through all the pages, but I do think it does make sense, Nick, for you to sort of highlight what this report does during the second reporting period, and maybe just hit the high
Right.
points of it, if that's helpful to anyone, because there is a lot of stuff. And yes, some of these reports we already read, the IRO reports are in here, and some of the other materials are things that we've seen before, but I think it would be helpful just to have an overview.
Sure, not a problem. So, and just sticking with the report that's in the small binder, because the bigger binder is just all the attachments that are referenced within the report itself.
See, I'm smart, I built a small mind.
Yeah, so did I. But really, a lot of the first section is very, kind of self-explanatory. So what it does is the annual report's kind of broken into two sections for us, which is, and I don't know how other organizations have had to deal with their CIAs, but with ours, because of the issues in the past, we have the 20 required items every year, and that's from our CIA. And then in the first reporting period and in this reporting period, we've had additional items that the monitor has requested us to provide, in addition to what's required under the CIA. So I think, let me just find what page it is. So 1 through 20 are all through the CIA. And then you'll see here at the top of page 30, additional items requested by the OIG, and that's where it starts. That these are items that aren't required as part of our corporate integrity agreement to be provided by the monitor every year, but these are items that she has requested. I will note that it did get a little bit smaller, I think, from the first reporting period to the second reporting period. So I know a lot of I know she's requested us to do a few different things this year around, but some of the things she requested from us last year, she did not request this year, so she cut down her list, because I checked with her to make sure she didn't want all of it on a continuing basis, which she didn't, so she highlighted just a couple of things. So really the first part of it is just kind of changes, right? So the first part of it is all the changes that have occurred were required under the CIA to provide this information. One of the things I will note, just in case anyone had any confusion, because I know it's referred in this report as a compliance committee, and this committee is the compliance committee. But within our CIA, we're required to have what they call a compliance committee in there. What we call it internally is an executive compliance work group that's made up of senior staff, the regional CEOs, and we meet. We're required to meet quarterly, but we generally meet monthly for the most part. So you're required to report any changes in that, the board, any certified employees. So some of the higher points is then here's so number 4 is some of the policies and procedures. So even though we didn't have any changes to our policies and procedures within the second reporting period, I went ahead and detailed all of the changes to our policies and procedures that have been subsequent to it. So we've updated multiple policies, as you can see from the bullet points, and then also I also listed in the last paragraph there, in the next sentence down, we've revised our fair market value and commercial reasonableness policy, and that's pending with the OIG for review and approval. And then also have draft policies that are close to finalization. I listed out those other policies as well, just so that way the monitor can see how much work that we are getting done and that we're reviewing these policies. The training plan really didn't have any subsequent or really major changes from the first reporting year to the second reporting period, other than the live trainings that we did live trainings for all covered persons in the first reporting period. And speaking with Ms. Ellis, she gave us permission to anyone that's attended a live training can now take it web-based. So we made that was really the only change that was made to the training plan from year 1 to 2. And she approved that verbally, and then I submitted it as required under the CIA to the OIG for review, and then they have 30 days to respond, and if they don't respond, then it's approved. The bigger area is probably 6, which is changes a description of any changes to our focus arrangement tracking system, changes to internal review and approval processes, and any changes to our tracking and monitoring procedures. So that's kind of one of the big areas within the report where there were a lot of changes during the second reporting period that began under the second reporting period and then was finalized under the third. A lot of them were finalized under the third reporting period. That goes to the implementation of our new contracting system, right? So that goes from us transitioning from MediTrack to Compliance 360 to be a vehicle for housing all contracts versus as we housed, depending on what type of contract it was, we housed it in two systems. Now everything's it's a one-stop shop. Then also any changes to our internal review and approval process. Obviously there were substantial changes to that because with the new system, we were able to put in, able to kind of make a more formal electronic review and approval process versus MediTrack, which was still sometimes manual, sometimes by email for certain contracts. All that's gone. So the third reporting period, all reviews, everything is documented within our system, within that one system. And then the tracking remuneration, which has been a major change, and really that has occurred. A lot of the work transpired, the work of finding a system, because we recently engaged a vendor to help us kind of compile all of the payments that we make and all of our contract information into one system. That establishing that process began under the second reporting period, but really didn't ramp up until the very end and into the third reporting period, really with the addition of our new CFO, Mr. Alan Goldsmith. And I can't state how instrumental he's been and his staff has been in getting this pushed through and done. Because
They can follow the money.
Yes.
What it
because
goes
we
into.
spent months and months and months in the second reporting period talking about this, and it's nice to finally see it, the action behind the words. And
Right.
there has been tons of actions in the third reporting period, so I try to explain that in here as well, of all the safeguards that have been put into place to ensure that payments that we're making are consistent with the contract and are consistent with the terms of that contract. And then the new system we've put in place and went live on November 1st is there to kind of really help us find those exceptions, right? If there's some person out there acting rogue and somehow with all the checks and balances that have been put in, because the system is large, but if somehow there's somebody gets something slipped through, this system will catch it. And it'll flag it as saying, hey, this payment was made to this vendor, to this payee.
Where's the contract?
And then there's nothing in your contract system that matches this payee. What's going on? And there may be a legitimate reason for that.
It could be a misname, something's out of whack,
Right.
something was spelled incorrect.
But we will know. And we will know right away. And we can address it right away instead of in the past of having to stumble upon things. So I really can't thank Alan enough for all the hard work of him and Alex Fernandez, who's Vice President of Finance under Mr. Goldsmith, has done a tremendous amount of work in this.
Right.
How quickly if a payment gets paid and it doesn't match the contract, how quickly are you notified or somebody notified that there's a discrepancy between a payment and a contract value?
It should have made,
What's that?
Right. Yeah, it shouldn't be made.
there's a few checks, so the AP people are, this is more of a manual check, are not paying the contract, for any invoice plus the contract checks. So make sure that if we do, if the rare case, then, on a monthly basis, there's reconciliation, based on, system diagram, in order to maybe be more able to
So if I've heard you correctly, on a monthly basis, you're saying that accounts payable are going to match it. If there's no contract, they're not going to pay. But assume it gets through on a monthly basis, you're going to be reviewing
check and balances in every part of the invoice process. So AP knows that they shouldn't be paying focus arrangements without a.
Ellen, could you come up so we can,
So AP knows that they shouldn't be paying focus arrangements without an invoice or a contract. So the next question is how does AP know that this is a focus arrangement? That was the big part of the committee, was they went through each one of the vendors and assigned a fair market focus arrangement or non-focus arrangement. So when it's flagged in the system, they know it's a focus arrangement, they know they should have a contract. So that's the manual check and balance, right? That's just the normal day-to-day transactions. So then I said, that's not good enough. We need to be more transparent. I want to do a monthly reconciliation that they can run out of this diver system, and we're going to be doing, internal audit is going to be doing audits of this specific process to make sure that AP and any of the people that are approving invoices are following the process. So there's check and balances at every part of the process. I've also told AP that under no circumstances, me, Bev Capasso, anybody should be doing an exception in paying invoices without a contract. Nobody can do it. If they do it, the AP people will be let go on the spot. It cannot be done. Nobody can do an exception, not even me.
but Ellen, if there's a contract and it's a 24-month contract with fair market value for 2 years, and it's, $20,000 a month, and is it coded in that you don't pay it past the
So that's a great
expiration date?
So that's a great question. So what we did is we had the accounting department set up a maximum PO in the system. So when they go to pay it and it's $20,000 and it's, let's say for 10 months it's $200,000 and now they're on $200,001, they can't match it in the system and they can't pay it.
So if I submit you, if I'm one of the facilities, I submitted an invoice to AP. When they get that invoice, when they go to enter the payment schedule, it's going to pop up and they're going to see that there's a contract in place, whether or not it's a focus arrangement.
You'll see a focus arrangement.
Right, so they can't produce a check without checking to see if it's a focus arrangement first.
And then they match it in the system.
Right.
So we put a maximum PO, so if the maximum amount is, let's just say $100,000, and they go over $100,001, they can't pay it. It doesn't match.
So they would have to manually do it at that point.
And there's no manual exceptions.
Perfect, okay.
So at that point, if we have allowed a service without a contract, then we're going to do a settlement because you cannot pay a vendor or anybody without a settlement payment. So you may start to see when I come to the board some settlement agreements, but that's an act of transparency. So sometimes things just happen, right? Sometimes a contract misses it, and we're going to handle those on a case-by-case basis with the administrators. But at the end of the day, if we procure a service and it's above the contract terms, we're going to bring it to you as from a transparency perspective, so you guys know what's going on from a governance perspective.
And as a show of how these checks and balances are already working, if you look at the last section, some of these were discovered because of the checks and balances that Alan put in place. So it was because AP raised the red flag of saying, hey, you're requesting to make a payment to these providers and we don't have a current contract.
And then we thought, when we talked about the auditing, right, and looking at it, we could have had just finance. We could have had like Alex or me do it. But I wanted to take it even a step further from a transparency perspective, so I'm having internal audit do the audits on those. So that way it's out of my, they're auditing me and my internal controls, which I think is the proper way to do things.
Well, I was personally want to say thank you, because that was an issue that came up a few times in the board meetings, and I feel like you guys listened, got a handle of it. I think you got a process in place, and I say, we'll back you 100%. You've got this process, stick to it, and I think you guys are doing a wonderful job, and I think by next year we're not going to have a lot of these issues, and that's going to be great. I mean, it's going to look like a totally different environment, and so you and Nick and your whole team, I appreciate all the effort, and I know everybody's been working night and day to get this done, so thank you.
Thank you for the comments. Any other questions?
I have one little one, and I don't know if it's for Alan or Nick, but some of the disclosure in here, and I understand why it is subsequent to the end of the reporting period.
Yes.
And it does show what we're doing and it makes sense to me.
Yep.
The comment that we needed a resolution of the timeshare leases and looking at, we had 18, I think, at the end of the second reporting period. And now we're down to 2.
Correct.
I think that's amazing, and I'd like to know how that came about. How
Well,
that,
we started that process within the second reporting period, but we also wanted to be considerate, owners of space, and we just didn't
Right.
want to kick people out.
Right.
Once that decision was made, that we were no longer going to continue with the timeshare leases. So we gave 90-day notice to those tenants that we were not going to continue with the lease. So with the timeshare lease, so that way it gave them enough time to find another location, and some of them even converted to full-time
Real
leases
lease.
here in our own buildings, right? So they just converted to full-time.
and all of those had
instead of
fair market
timeshare.
value analysis at the conversion
The
point?
full-time?
Uh-huh.
Yes.
Oh, yeah, you can't get a contract through.
Okay.
Yeah.
I just want to make sure, because that obviously was an issue before. So now we only have 2 people that we're working with to try to get out of that timeshare arrangement in
Correct.
the medical office.
Yeah, one expires, if my memory
Next
serves,
year
in
too.
April and one in December.
Right, but trying to get something done before the end of that, at worst case scenario, it's terminated.
I know the real estate department is working with both.
Great.
It's currently working with
And
both.
to that point, it sounds great, but it was a lot of hard work.
Oh, no,
So
I
again,
know it.
I want to commend the team. We met with talking to physicians, staff. It wasn't easy, but we knew it was the right thing to do, so we did it. And so with just 2,
It's amazing, because I've been on the other side trying to get
Let me
some of
tell
those.
you, yeah.
It's really hard when a person has a contract.
and it's a lot of uncomfortable,
Yes.
difficult conversations we had.
And it sounds
Many.
like in most of these, if not all, that something amenable was worked out with the timeshare tenants, so that either they found another location,
For the
or
most
they,
part.
Yeah.
or they converted to a full-time lease.
Right. Yeah, and then so that way they can come and go from
And
the
they're just
spaces
such
they
nightmares.
lease.
I mean, they're just such
Yeah.
nightmares that it's just better that, and it says in here that the management made the determination to not enter into any more in the second reporting period.
Mm-hmm.
Does anyone remember when that was? Because I missed it somehow.
I don't know of an
You know?
exact date.
Do you know that, Gino?
I don't know the date.
Yeah. It was
So-
towards the end of the second reporting period.
Okay.
Yeah.
Okay, so if
Yeah.
you made that determination and made all these changes with the 18 and only 2 left, it's very commendable. And I thank you guys. It's one heartache we won't have down the road, because you know they would be coming.
Oh,
Yeah.
no. We knew it was the right thing.
Right, it's the right thing to do.
August, we said, that's it, they're out. But we had to do it the 90 days, we had to give them an opportunity, that's their business.
Yeah.
So I think we did.
One plus, and we don't want to impact patient care as well.
Oh, no.
Right, to where it's just the next day they're on the street with nowhere for their
Well, you
patients
can't
to
do
go.
that.
Yeah.
We have bigger issues.
Nope.
No, but to finesse it and to do it the right way, treat people the right way, and make
Right.
the difficult decision to move forward, because these things can really come back to get you.
Yep, and we were always, and all through the process, we were always kept the monitor in the loop of where we stood on things, and even with the other section within here, the full-time leases, the resolution of that, always kept her in the loop of where we're at. So, I mean, really, I don't think anything in this report should be a surprise to her. We have always kept her in the know about what's going on. And even with the last section of the exception, she's fully aware of that. She asked us to put it in there, right? So even when we had the conversation, when we discovered it, about the focus arrangements that were paid without a contract, she knew and asked us to put that in our annual report. Some of the other bigger sections, number 8, so that's our response to the IRO transaction review that was done on October 27th. For the second reporting period, so that goes through and outlines our responses to any of the deficiencies or concerns that they found. And it really goes back, and a lot of it, as you read through this, you'll see it really goes back to the confusion of what Meditrack was. In labeling documents, it was a mess. So they did their review based on Meditrack, and so, I mean, we were able to find most of the things that were missing, but they, again, they were not labeled correctly. They were not, so I mean, it really took time to dig through all the contract files to find all of this stuff. And then,
Right?
let's see.
Okay.
And then really some of the other big changes, or some of the other big sections on here is kind of towards the end, again, within the additional items requested. So the timeshare lease resolution, the progress in addressing each recommendation from the first reporting period. So that's Exhibit 26 in your binder. So that's going through all the stuff that the IRO said from the first reporting period, all the things, the deficiencies, the recommendations, everything they wrote. That's then our response. So she wanted an update of where are we at on each of those items. So then that spreadsheet is going through of where we're at on each one of those items. The medical directorship assessment, I think, is another area to highlight within here, all the work that was done on that, in reviewing all of our medical directorships that we have at Broward Health, and assessing the need for each one of those medical directorships. We ended up doing away with 23 medical directorships based on our review. Then the assessment of the lease, so the full-time lease, so that was, as explained in the report, the issue with the load factor that Ms. Ellis was fully aware of, and that we got that addressed. We now have it included in our F&Bs, and we're working on getting all of our full-time tenants under brand new leases. That includes all of it.
I know that Commissioner Rodriguez has a question for you, and then I have one follow-up.
Sure. Sorry.
Well, thank you. I want to commend you because negotiating real estate is not one of the easiest things in the world. I tell you that because I do it every day. And I know that this was becoming kind of a cumbersome issue. And for those members of the audience here that they may look at a timeshare like I'm buying a timeshare in Hawaii, maybe you want to explain a little bit what.
Yeah, I mean, and it really, it really was Gino Santorio, our COO, and our real estate department that really put in just a massive amount of work in getting.
I would say, Nick, that was really Micah Fisher from real estate.
Yeah.
Who was the person?
Micah Fisher.
Yeah, who's the manager of the real estate department. So, and it is, and to do timeshares, especially in a healthcare environment, is extremely burdensome, because you have to, when you're leasing to physicians, you have to ensure that if they've did a timeshare for 4 hours, they were there only 4 hours.
You have a chip inside of it.
Yeah, and essentially, right? And so the constant monitoring and oversight, and it's extremely burdensome. And from everything we heard, we have good demand for our full-time, for our buildings. So I don't think any of the space is going to be sitting empty. So it was a lot of work, but yeah, Micah Fisher, who's the real estate manager, did quite a bit.
It's very difficult to track unless you plant a chip on them.
Yeah.
And it's just no way to.
It is.
But thanks.
Anyone else?
Thank you.
Question?
Yes, I just have a couple of questions. I want to go
Sure.
back to the tracking systems. I understand the migration, from MediTrack to Compliance 360.
Yep.
Very positive migration. It sounds like that will help ensure ongoing compliance. When was that transition begun? I mean, it says it was begun during the second.
It began on August 21st, 2017 is when we began the transition to it. So we were still using MediTrack through the complete term of the second reporting period, but we began to transition everything over to Compliance 360 during the second reporting period, and then it went live in the third reporting period. And as in the report here, we have had some issues with 360 and the data, and we're working to ensure that we get all of that tidied up and accurate.
Like, we may need to just clarify those dates because between when it went live and when it was fully implemented.
Okay.
Okay. That's a good
Because it
comment.
looks like it's here indicates it went live on August 21st, but that's when
Yeah, I
it was
think I put
started.
right after, which section is that? I'm sorry.
6A, page
6A.
12.
Okay. I'll make it more clear.
Okay, if you could, I
That's
think
why I
that'd be
put
helpful.
afterwards began the process of transitioning. But I'll make it more clear.
All right, so that's when the transition began, and then in
Yeah.
October is when it was fully implemented, essentially?
I believe it'd be September is when we had it. End of September, beginning of October.
Okay.
So on that day, did everything just switch over? I don't understand. I mean, I understand transitioning from Metatrack and everything else,
Yeah.
but what actually happened on the day that you quote went live? Did everything appear
On
in
the
one system?
21st?
On the one system?
No.
No.
So on the 21st, that's when all of the data was supposed to be in. So the Contracts Administration Department did a data dump from Meditrack
Okay.
and dumped that information into Compliance 360,
Okay.
right? So then that way we had all historical information, all current information, or that's what we were supposed to have. But there were still things running through Meditrack, so there was never that real clean cutoff date.
Well, is it now?
And, it is now.
Okay,
Yes,
so-
and I put in the report,
Yeah.
as of the day of this report, all new or renewed focus arrangements only go through Compliance 360.
Okay, so Metatrack is gone, just for
It's,
history.
we still have it for
History.
archive purposes,
Okay.
but we are not using it as a contracts database. We are not using Ariba as a contracts database.
And you'd only go back to that if there was an issue as to when something actually begun or there was a question in 360.
Correct. I mean, we're using it to validate the data within 360.
Okay.
Right? So here's what we had in Meditrack as the dates, here's the contracts we had, here's all the documents. Did that transition, right? So now we're doing a quality assurance review to ensure that all of those documents, all of that data transitioned over to Compliance 360 accurately.
Okay.
And in terms of the way the system operates, you indicated on page 13 that there were more data points in Meditrack. You were able to reduce those data points in the new environment, which
Correct.
I think is more streamlined.
Yep.
How are those data points gathered? Is someone actually going in and manually entering those?
Yes.
For each contract? So they complete that, and then that gets stored into the database for reference?
Yeah, depending on the type of contract, so with Compliance 360, we have different assessments. Instead of with Meditrack, it was kind of a one or, all or nothing type system. With Compliance 360, we were able to create these assessments, is what SAA Global calls them. So then based on the type of contract it is, would be the assessment that would populate. And then those questions would be answered instead of, in the past with Meditrack, no matter what contract you were entering, you had to scroll through all the questions and figure out which applied. This one should, with the assessments, once if you select a medical directorship, then the questions relevant to the medical directorship will populate for the contract initiator to complete and fill out. So, but then even subsequent to that, we looked at all the questions and combined them, took out redundancy. So that's what I was getting at in regards to the reduction in data points, is that the 963 data points, it translated into 7,000 questions, and we were able to get that down. And then also there were multiple workflows within Meditrack, and we were able to reduce the number of workflows as well with Compliance 360.
And with specific regard to the focus arrangements that are within Compliance 360, once those data points are entered, is there a second check to make sure they're entered correctly? Is there some oversight?
There's multiple checks along the way. So as the contract initiator enters it, it's going to be reviewed by the compliance department. It's going to be reviewed by the general counsel for focus arrangements. It's going to be reviewed by contracts administration, right? So even, as the contract initiator is putting that in, they're going to look to make sure all the questions are complete, all the information was provided. But then really it's kind of the general counsel's office, the compliance department, the executives as it comes for their review, like that, do the answers make sense? Right? So just because a question's answered doesn't mean that it's a legitimate answer, right? So you want to make sure that, and that really kind of falls on all the departments throughout the review because that's really why they're providing those questions, right? Not only for us to track remuneration and everything like that, but in order for all of us to do our jobs and ensure that we're meeting federal regulations and that we're meeting the requirements of the CIA, we we need all that information. A lot of it we need for the fair market value and commercial reasonableness. So a lot of it, if something doesn't make sense, gets caught at that point.
And it sounds like the new system will allow for administrative streamlining, which in the future should hopefully save some personnel costs, as there's less questions to answer and less data.
We hope so, and I know, and currently we're doing, Mr. Goldsmith again is doing a full review of the system, and had some ideas to, I think, even further streamline it, which I think will work really well. So kind of just like with the policies where I said, you know, it's a living document. I think even our systems are living systems, right? So as we find ways to improve them, we're always trying to do that and to make everyone's job as easy and efficient as possible while still maintaining, you know, all the information that we need and the integrity of that information.
And did Compliance 360 deliver everything that we had hoped it would? Or does it need to be further refined?
I think it still needs to be further refined. You know, we didn't implement a perfect system, but if we continued to wait for it to be perfect, we'd still be talking about it today, you know, about getting it implemented. So I think what we really needed to do was to get the system in place, and then that would show us our strengths and weaknesses with that system, and that's what it did. So as we've switched to that system, now we're getting the feedback from the users of what works, what doesn't work, and then what doesn't work, we're trying to see what changes we can make to that system to make it work better for everyone.
And who's coordinating that process? That would be Alan?
Yeah.
All right, and just to clarify, my understanding is that Metatrack had satisfied our obligations under the CIA. It's just Compliance 360 is a better system going forward.
Yeah. Yeah, it does solve a lot of the deficiencies that we had with Meditrack that made things difficult to track and everything like that. So I personally feel it's a better system than Meditrack.
All right, thank you.
Anyone else questions? I have one more,
Sure.
because I know Commissioner Uri is going to bring it up.
Okay.
And that is the certifications of the certifying employees, and I noticed, I went through some of them with you, but do we have them from everybody, or are we still missing some?
The only ones that we're missing is mine and Lynn's. I mean, we're just...
Well, we'll get yours.
Yeah.
Okay.
But I mean, we're working on those.
Okay.
I mean, so all the employees, there's, which I do need to actually, in our conversation earlier today, in the one section for the annual certifications, there were a few employees that left during the second reporting period that I wasn't aware that had left till after the fact, so I didn't obtain annual certifications from them. So I need to specify that within the
Right.
report.
Okay. So, but that's just going to be in the narrative.
It will be, yes.
Okay.
I'll point out which ones, and that, you know, that they had, you know, given their notice and left, and I wasn't aware that they had given their notice and moved on to other jobs, and wasn't able to get an annual certification
Okay.
from them. I think it's 2 people.
Okay. So, and the other issue is the individuals who had exceptions, and there were some with a number of them. I
Yep.
was able to identify most of them, and I understand why they were there.
Yeah.
I kind of think I know what they were getting at, and I didn't have a problem with it. Were there any that concerned you? Or were there any on the exceptions that, from a compliance perspective, means we need to do some research?
Yes, but then the one that as they came in, I reviewed them and replied back. So one that concerned me, that still concerns me, I'm working with contracts administration to address.
Okay.
So there were a couple things in regards to just reports and stuff
So
like
it
that.
did what it
that I
was
wanna make
supposed to
sure.
do. It
Yep.
pointed out things that we need to
That's
look at.
the
things-
point of these things.
Yep, okay.
It
Well,
is.
that wasn't the way it was last
Right,
time.
and when people put stuff, I replied right back to them like,
What is that?
what do you mean?
Right.
I haven't heard about this, you know,
Right.
and to get, and some of them, we were just able to clarify right then and there, okay, and then, and like
Some
I
of
said,
them
there's a
make
couple that
perfect
we're
sense,
still
we know
working
that.
on.
Okay.
Yep.
Okay, so, other than the resolution that we'll see tomorrow, and hopefully we'll be in a position to sign
Yep.
at the board meeting, then your plan is to get everything packaged up and get it there
Let's
on
do the
Friday?
4th. I would love to get it out Friday.
Is the-
Thursday will be the day spending, making everything look nice and
Uh-huh.
neat and getting it all, and then hopefully get it
But
out
worst
Friday.
case scenario, you FedEx it on Monday.
Yeah, worst case scenario goes Monday.
but, I mean, it looks so much better than the first draft that, well, that's not even in the same hemisphere. I mean, I'm very pleased with what you guys have done, and I know it wasn't, you spearheaded it, but I know everybody was involved
Sure.
in it, and I've got to believe that the powers that be in Washington have got to be pleased with what this whole institution has done. It's been painful
Right.
by everybody involved, but it's, in my heart, it's the right thing. We've done the right thing, and we're going to continue to do the right thing for the employees, the patients, and everyone in the community. So thank you very much.
Thank you.
And if there are no further questions, do you have any further comments, Nick, or
I don't.
Passo? Okay, so do I have a motion to adjourn?
So moved.
Do I have a second?
Second?
All in favor?
Aye.
Aye.
So this meeting is officially adjourned.